Hello, friends. Welcome to the session. This session is about the recently conducted FMG examination in July 2025, and we'll be seeing the ENT question asked. Please inform your friends also. And before we start, there's a disclaimer. This is only the reflection of the questions asked in the real examination. But you know there is always some amount of error in the recall statement, style of questioning, and the choices also are sometimes not exactly similar. But overall, we will be seeing that what kind of topics have been asked and what was the correct answer for those questions as per the, whatever information I got from the students only. So, guys, let me deep dive into, what kind of topics were touched this time. And I'm very happy to share that they were expected topics. If you have been, seeing the, the video lectures, complete video lectures, and the our HIT session, the MIQ session conducted on the YouTube also, you will be seeing one thing we discussed very elaborately was the nerves involved in larynx actually. Thyroid surgery, nerve involvement, the injury in the RLN, SLN, ELN discussed over there, and fishbone got stuck, piriform sinus question was there. There's no paper is complete without glue ear. Again, glue ear had, approximately two questions which I got from people, and I'll be showing you a question. Third one, mucor micosis. I'm telling you, because the paper might be feeling that, it was very, tough overall paper too, but look at the ENT, mucor micosis, diabetic patient, or black thing. Mucor micosis was very easy diagnosed over there. Then they of course asked the tympanogram, like this asked the AS tympanogram, maybe type B tympanogram. We'll discuss about that. So again, airway was asked, stridor was asked, which was discussed number of times: inspiratory stridor, expiratory stridor, biphasic stridor, and tracheostomy, cough of tracheostomy to prevent aspiration, and airway management. If the intubation is not possible, what is the furthest thing possible over there? And trauma to ear injury happened, bleeding from ear, what would you do? Of course, CT scan of temporal bone. Ear is nothing but a journey in the temporal aortic canal to internal aortic canal. And of course, there are some bouncer question always. If there are 15, 16 question out of always new question like uncinate process. But then I'll tell you, as I've been telling time and again, the paper does not, have all the questions directly picked up from the notes only, but your common sense is always asked. Uncinate process attachment, we'll see what we had discussed. But few learnings are very clear. If a future person is a batch aspirant is seeing this video, two things are very, very clear right now. From last three sessions, they're making more and more evident. Number one, do the full course in ENT, for sure. Do the full course in ENT, the main notes, the main video lectures, you should be doing that. That is the one learning. Number two is the old Telegram, YouTube videos, the summary videos, they are not appropriate. They're only the YouTube summary videos. Like we have put one video of ENT, revision, but that is only applicable once the main content has been done in the main videos, main video lectures, main notes should have been done. And let us see now one by one what question were asked. Let me show you the people. I would request you to keep answering in the chat box also if you are there live right now with me, that what did you answer and did you not expect this question over there? Now, fine. Please see the professional singer. I think this question was there in our MIQ session also and the HIT session also in DocTutorials app. Actually, professional singer present with difficulty raising the pitch of her voice after thyroid surgery. Which nerve got injured? I think this, if you remember this particular thing from our notes also, thyroid gland has got two nerves, one nerve at the lower pole. Anybody which nerve at the lower pole? And this session will be useful for the NEET PG INSTT also. RLN is there. Everybody join me in the chat box. RLN. And then is the SLN nerve. SLN have two branches, ELN and ILN. And if you remember, the all muscle of larynx supplied by recurrent nerve except cricothyroid, which is supplied by external branch of spiralaryngeal nerve. So guys, if you remember, cricothyroid is the main tensor of vocal cord and that gives you quality of voice. And if SLN is injured, please see, SLN got two branches. Look at your notes also. You will be seeing ELN, is a branch of that. Cricothyroid muscle is paralyzed. Its main tensor of vocal cord, chief complaint, poor quality of voice, and examination shows bowed down vocal cord. Please look at your notes also simultaneously. You will see it will written star question over there. And just see, we written over there also in the main notes also, in the HIT notes, also in the MIQ of YouTube also, that If after thyroid surgery, patient cannot sing a song properly, it is SLN or ELN injury question. And if after thyroid surgery, patient is unable to breathe properly, it is bilateral RLN injury question. This has been done time and again. I would really, like, please understand that, let us not take anything like, like this thing that it is difficult. It is clinical, conceptual, yes. Please see, professional singer unable to reach the pitch, poor quality of voice. Of course, the answer is external laryngeal nerve, which is a branch of superior laryngeal nerve. How many of you did this question correctly? How many of you did this question correctly? I want to see everyone. Okay, fine. Okay, so its the answer is B in this question. Perfect. Now, again, second question. I would like to show you one snippet from our main notes over there. Please see. Everybody, please comment. Do you remember this discussion over there that we said that this snippet? Just look at your notes and just see over there, that fishbone impaction question. And I think this is the snippet directly from the notes only. And I think I told in the HIT session also and in the MIQ session also that this was a direct INSTT recall. That please see, it is not a thing we have made now. It is actually part of the workbook. Please see that fishbone got stuck while removing the foreign body. Surgeon injured the internal laryngeal nerve. Where was the foreign body stuck? The answer is piriform sinus. How many of you attempt this question? See, look at two question, straightforward from the conceptual, understanding, and they are actually discussed in the notes exactly similarly. Okay, so don't create undue panic over there. Every time there are one or two bouncer, we are not saying that there won't be any bounce over there. Okay, fine. So I think everybody knows fishbone got stuck in piriform sinus. So the which nerve got injured? I think the answer of this question is internal laryngeal nerve. And I think we already told that in NEET PG also they asked, this is the main nerve to prevent aspiration also, because this is the nerve which supplies the supraglottis and the piriform sinus area. This is the piriform sinus area. I think I would, request everyone to, look at the notes and see, and create a genuine hope right now that we actually deserve to pass the examination. Now this was again tympanometry, like if you remember tympanometry, type A tympanogram, type B tympanogram. The flat one is type B. It's not type B, of course. And I'm not sure about the exact recall they gave, which I think they gave one more image over here, and they asked this one over there. That this is bell shape is type A. So two choices are ruled out. Type A will be bell shaped, and type B will be flat. I think time and again, and I want to show you one snippet from the HIT session of doctorals. This is HIT session, and this one we see type A is normal, type B is flat, glue here, and then anything less than A is AS curve. This is AS curve over there. So this was the AS curve over there, and this was a snippet from the HIT program only. This thing, high impact training program, and AS to tympanogram. A is not possible. A is not possible, and because A will be bell-shaped curve, anything less than A will be AS curve, and B is a flat curve over there. So answer is AS curve. Anybody? AS curve is seen in which condition? AS curve is seen in which condition? Yes. Very good. Very good. Please start commenting in the chat box. I should know, how many questions you attempted correctly also, because that is what the litmus test is. And we never say in the class also that we can score every question, but majority of the question be able to do that. AS curve is seen in otosclerosis, and AD curve is seen in osteodislocation. If any NEET PG person is attending this session, please understand tympanometry, also called impedance audiometry or tympanogram or impedance audiogram, is a very, very important thing. Very, very, very. How many of you attempt this question correctly? Okay. So I think everyone, this is the, type A curve is normal, type B flat curve is in glue ear or perforation of tympanic membrane. And, AS curve, otosclerosis, AD curve is osteodislocation. Any curve on the negative side of 0 is type C curve. Don't forget this question. Now, correct me if I'm wrong. I got, two questions on the glue ear. A child, 5-year-old child present with chronic nasal obstruction, mouth breathing, hearing loss. So anytime we say, I think time and again we discussed in the class also, any child with the mouth breathing problem, with the hearing loss, it's a question of adenoid hypertrophy plus glue ear. Okay. And, the clinical examination suggests adenoid hypertrophy. There can be error in recall. I understand that. And what type of tympanogram? Type B tympanogram or flat tympanogram is seen in the, glue ear also called as otitis media with effusion. Glue ear, the other names are serous otitis media, secretory otitis media, but the latest name is otitis media effusion actually. So I think this is written over there that glue ear would be actually, like asked somewhere or other. Please see your notes, and I think we have drawn 7 stars on the glue ear. 7 stars are on the glue ear. Why? Because glue ear is always asked very commonly. Do you remember this question about glue ear came in the paper, bache? Glue ear, glue ear, 7 star topic. Most commonly asked topic in ear is glue ear, and I think glue ear again was there. Okay, fine. Okay, could you attempt this question correctly? Please answer. Okay, now again, one question of glue ear was it was sent to me like this: a child with the mouth breathing, poor school performance is indirect indicator of the hearing loss. On examination of otoscopy, retracted TM with fluid behind tympanic membrane. I think fluid behind tympanic membrane is again adenoid hypertrophy with glue ear, and glue ear is also called the glue ear is also called the otitis media with effusion. I think this question was certainly there, and a lot of people have sent me this question. Did you attempt this question correctly? Did you attempt this question correctly? Yogesh, for piriform sinus question, of course, internal laryngeal now. I'll show you once again. Guys, this was there. This has been sent across all the groups actually, that the poor school performance with the fluid behind tympanic membrane, and this was actually the glue ear. But yes, again I say, please do latest notes. Please tell your juniors, do not watch Telegram videos, do not watch YouTube videos. I'm requesting you. The standard recipe is do the main videos of ENT. After that, you do the QRP 5.0 videos. Please tell your future junior people preparing for NEET PG FMG videos separate in the app. And if you have got any junior in your university, tell them please do not really use the old Telegram leaked videos, because they create a pseudo feeling that you know it. But glue ear, the latest name is otitis media effusion, might not be there. And if you just do 3 hour, 4 hour of YouTube, recall videos or YouTube revision videos, you are taking a very shortcut, approach. And this approach is not working for all the clinical subjects now. Okay, to fine, everybody, do it one thing. Today, you call one junior from your university or post it in your, groups over there in university. From my end, actually, it is a request from my end. Please do not use the number one old Telegram videos or YouTube videos for the preparation of ENT. Definitely main videos followed by QRP 5.0 revision videos close to examination. And please do attend our HIT session and the MIQ session. And I think that should be covering the ENT. Let us correct what is going wrong. Because I can sense when people say, I don't know the answer of piriform sinus question. Somebody is asking right now also. This piriform sinus question was there in the complete notes over there. Na? This is a snippet of the notes only. So my worry is a lot of people take shortcuts and they get stuck between 140 and this thing. Please tell your juniors to please do the main content of the subject. Okay, now everybody look at this question. Now this, see, glue here is a complete topic, and look at your notes. I think you have drawn the 7 stars. Glue needs grommet. We discussed that. Any fluid behind tympanic membrane, air bubble behind tympanic membrane will be glue ear, also called otitis media with the effusion. Now, this was again, as I always say, there are always, last time it was type 3 tympanoplasty picture, if you remember, they gave that, and there are bouncer. We cannot really say that nothing, but what they say, patient has got maxillary cancer. It is not that maxillary cancer topic is not there in our FMG notes, actually. Of course, NEET PG notes have got more detail, like Weber-Ferguson approach is there. And, in Weber-Ferguson approach, we always say it's a lip splitting incision, you can see, and the lip has been cut over there and maxilla has been removed completely. It is absolutely the peroperative picture of the total maxillectomy done with the help of Weber-Ferguson incision, Weber-Ferguson approach. Any NEET PG student over there, just check the main video content or main video notes over there. It's over there. Any lip splitting incision, the lip splitting incision is Weber-Ferguson approach. But if you're an FMG student, I understand that. But what is removed over there is complete maxilla. The maxilla, the hard palate is also part of the maxilla. So it has been removed. So which surgery could have been done? Answer is total maxillectomy. Total maxillectomy. In total maxillectomy, this question was, this question is yes, I understand. It's a little tricky question, but if you just apply your presence of mind, our notes have got maxillary sinus cancer, Ongren line over there. It is written over there that it is actually, due to two reasons. It can be hardwood dust, wood dust exposure or nickel exposure can lead to this cancer. And this patient would need a surgery, total maxillectomy. Yes, this picture shows that maxilla has been removed. So answer is total maxillectomy in this case. Now please see, this question I would want everyone to please see. Ethmoid is not. Ethmoid is not. That's why I say, where is ethmoid? Where is ethmoid? Ethmoid is here. Ethmoid is here. Okay. And is he not saying maxillary sinus cancer? Maxillary sinus cancer? Ethmoidal, like ethmoidectomy. Ethmoidectomy will be ethmoid cancer, but maxillary sinus cancer is maxillectomy. Okay, fine. So it is actually total maxillectomy because it's not. If you remember, NEET PG people, you will be seeing in the notes, medial maxillectomy is done for the inverted papilloma of nose or Ringett's tumor. There's a definite difference between the FMG content, NEET PG content. We cannot overburden also the FMG aspirants because we know the time is 4.5 months for the first information to third revision also. Okay. Now, it is not degloving. Degloving is completely lifting off the, the skin of the face. Complete degloving actually. Okay, fine. Now, everybody, this question I would want everyone, please, and tell me, did you attempt it correctly or not? Because this is beautiful question discussed. 60-year-old male complain of gradual worsening of hearing, high frequency sound, and 60-year-old male. And problem get worse in the noisy environment. It cannot be Meniere's. Why? Meniere is having vertigo, tinnitus, and hearing loss, and it is episodic. And Meniere is anybody, either low frequency or high frequency. Low frequency or high frequency. Let me show you the snippet of the main notes. All of you, please check the main notes over there. Please see over there. This is your main notes over there. The two special audiogram, Meniere disease versus presbycusis. And I would request everyone to, be a little bit more, hopeful over there. Just look at your notes, main content notes, Meniere disease. If you've done Telegram hacked videos of 2020 or 2021, that would not be having all this. I'm giving guarantee on that. But 2021 and now 2025, we are talking about. All those people who have attended the main content, main notes, please look at your notes and tell me in the chat box, did you attempt this question correctly? Presbycusis, the answer, age-related hearing loss. Age-related hearing loss, fine. Now, age-related hearing loss involve both cochlea. Please look at your notes also. And it starts from the basal turn of cochlea. Now, basal turn of cochlea senses high frequency sound and high frequency SNH is seen, and therefore it shows the sloping audiogram. May I request everyone to look at the main content notes and see, is this question correct for you or not? Tell me. Everybody, did you attempt this question correctly? I hope nobody lost this mark. If you attended the latest content in the latest video lectures, did you attempt, this question correctly? So answer this question will be presbycusis. It can't be Meniere's. Why? Meniere will be having number one, episodic pattern. Then vertigo, tinnitus, hearing loss, the triad. Otosclerosis is not seen in 6-year-old male. It is more common in female, and that too 20 to 40 years. 20 to 40 years. I want to go through till now whatever questions we have done. Why? Because you should know where we are standing actually. You know what? This question, thyroid nerve injury, patient can't sing a song. Answer is external laryngeal nerve. I hope this one is correct. Number two, pariform sinus fishbone stuck question, ILN, straightforward question. I hope this is correct for everyone. Third is tympanogram question. We've done that. Now, the glue ear question, maybe two questions, one question. That should be correct because glue ear was again the 7-star topic. This was, yes, I can understand. This was a little, you have to apply, but you can go wrong also in this. And this one, of course, presbycusis. Okay, now, let me tell you one now, next one. After the presbycusis, look at your notes and please see the Mucor Micosis. This was discussed in detail. HIV positive patient, diabetic patients, uncontrolled diabetic patient, patient on steroid therapies, and COVID-19 patient. I think what else we want in the next question. 65-year-old diabetic patient present with facial pain and blackish discoloration in the nose. CT scan pictures give. I told you a lot of time they give you a picture just to make it an ornamental looking good question. But I know my concept. 65-year-old diabetic patient with blackish discoloration in the nose. It is rhino-orbital cerebral mucor micosis. Did you attempt this question correctly? Tell me. Okay. I think it can't be fungal sinusitis or chronic rhinosinusitis. Why? There is invasion of the bone over there, but you know the CT is not the very appropriate investigation. It is MRI, contrast MRI, and that shows black turbinate sign. And we discussed into that detail. Guys, did you score these questions out of these, like one question on mucor micosis should be correct, press bicusis should be correct, two, this may be this thing, then the glue here, number 3, then tympanometry, number 4, 5 is glue here again, then 2 nerve injury, 7 and 8. Tell me very clearly, like till now, out of 8, maybe 7 questions will be correct by now. We are not here to prove that, we teach everything like this, that none of my business after 21 years, my business is we should add volume to your marks over there. Believe me very clearly. But for that, please guide your juniors to be comprehensive and conceptual about ENT and doing the main content. Okay. अगर face का image आया था तो बहुत ही आसान है बेटा. That's okay. He's saying that this image was not there. Probably anybody can comment. He says face image was there. Then still, I told you, who here remember this statement in the which done in the MIQ session, HIT session, in the classes, video lectures. मैंने क्लास में कितनी बार बोला था और लास्ट वाला इंस्टाग्राम लाइव में भी बोला कि शब्दों को शब्दों से नहीं मिलाना, भावनाओं को भावनाओं से मिलाना. Don't match word to word, match just concept. Crack the clinical vignette and move forward. Do you remember this thing told to you in the last Insta live or the classes also, the the MIQ or the HIT session? You remember this because this is what the gist of the paper 2 is. Don't match everything. Like 65-year-old diabetic, black. I have knowledge, it's mucor micosis. Yes. Now, again, little bit, like twist. I told you question come based on notes. Now, which of the following is attachment of superior tip of the uncinate process? Uncinate process. It's not that we don't know uncinate process. It is not that we don't know uncinate process. I think you remember this from your notes. Middle meatus has got 3 important areas. Bullath medalis. You remember this is bullath medalis. You remember this is UP. What is UP? Uncinate process. This is what I hope you remember the class video also. This uncinate process. It's a sickle-shaped bone which covers bullath medalis. Okay, fine. Very good. Now, this is attaching mostly to, I don't know the choices correctly. There's a disclaimer. This is a little PG level question. I agree. This is a PG level question. No, not NEET PG one. Is the second year PG Viva, on the rounds we ask this question to our PG second year, third year. But if you just apply your common sense, if the choices were like this, middle turbinate, inferior turbinate, middle meatus, bullath medalis, attachment of superior tip of uncinate process. I think if you know this is your middle turbinate, and this is your uncinate process. Out of these choices given, I think you can say that this is attaching to the middle turbinate. There are 3 attachments possible of the upper tip of this uncinate process. Most commonly, it's the medial wall of the orbital lamina papyracea. Other is the middle turbinate, and third is the skull base over there. It can go up to the skull side also. That is there. Yes, please see. Yes, I understand base of skull was there. But if by chance this was there, then the answer was middle turbinate. Guys, I do understand as this question. It's not that we don't know uncinate process. It was not something, a word which we do not know. I told you some question directly picked from the notes. Some question based on notes where you have to apply your common sense over there. Of course, upper tip cannot be inferior turbinate, cannot be the middle turbinate. Bullath medalis is the part of this thing. But out of this, if these 4 choices were there, then the answer is uncinate process. Is this correct for anybody? Anybody who marked this question as middle turbinate? Other choice, the other attachment are lamina papyracea, the most common one, which is the medial wall of orbit. Number 2 is middle turbinate, second common attachment. Third is the base of skull area. Very good. So that if you mark middle turbinate and if lamina papyracea was not there, then certainly middle turbinate is the correct answer because that is the second common attachment. Everybody, please comment over there. Okay. Very good. This is a bonus question for everyone then. If you have marked this question correctly, it means you understood in the class, in the main video lecture. Because if you just take the 3-hour video for ENT, it won't work. Please convey my message to all your juniors. Please ask them to come in the main arena, and paper is matching the NEET PG level. I'm not having no doubt about that. Now, we discussed stridor, multiple stridor. If you see the main video, stridor video is there. Stridor sound is there. What is stridor? Stridor is the noisy breathing. This is a snippet from our notes only. Noisy breathing causes airway obstruction. I told you 3 types of stridor. The inspiratory stridor is due to supraglottic problem. Pharynx and supraglottic obstruction lead to the inspiratory stridor. And the subglottic problem lead to biphasic stridor. I think we had put this over there. Supraglottic problem lead to inspiratory stridor, and subglottic problem lead to biphasic stridor. I think this is there over there. And I got this question that this was there, that they asked, it was inspiratory stridor, where was the blockage? The answer is the supraglottic. Supraglottics. Yes. Yeah. There were 2 questions on tympanogram. Very good, Vamshi. I agree with you. In fact, a lot of people send me these 2 questions, and I showed Vamshi these 2 questions also. This was again a straightforward question, which Vamshi is saying over there, that nasal blockage is there, mouth breathing there, and the hearing loss there. Adenohypertrophic glue ear, answer is type B tympanogram. I think this is an additional question. By now, out of 10, like 9 questions are straightforward. And yes, AS tympanogram was a visual question over there. I agree. Correct. Guys, did you attempt this question correctly? The supraglottic problem lead to inspiratory stridor, and subglottic problem lead to the biphasic stridor. I think we said that 2 diseases lead to inspiratory stridor. One is the laryngomalacia, other is the acute epiglottitis, and the ALTB group lead to subglottic problem, therefore the biphasic stridor. Let's look at this. Let us don't feel unnecessary anxiety in the time when the result is yet to be declared. Just create, and NEET PG people, please look at these questions. There are possible questions in your paper also. I'm telling you very clearly, NEET PG people, don't ignore these questions. They can be straight away picked and put like that, or the topic will be similar over there. Again, blue ear, again, one more time. Some people are sending me this question. Child with mouth breathing, high arch palate, poor school performance. What type of hearing loss expected in this child? Again, blue ear, the 3rd question was sent like that. This is again, mouth breathing, poor school performance, adenohypertrophy with blue ear. And what type of loss would it be? Conductive hearing loss. Conductive hearing. If you remember, the one question asked in the MIQ and the HIT session also was, one of the following is cannot cause sensory neural hearing loss. If you remember the TND paper of 110 question, one of the question was, which of the following cannot cause the sensory neural hearing loss? The answer to that question was the glue ear. Why? Glue ear is the cause of conductive hearing loss. Guys, please see, glue ear actually has given by now 2 to 3 questions. Type B tympanogram question, as somebody said that. Type of hearing loss question, conductive hearing loss. Then the diagnosis question, fluid behind tympanogram. This was one question, because I have waited for 2 days to give the recall, because I tried to match a lot of people telling what question. A lot of people said that this was there. The one, let me show you glue ear question. One was the type of hearing loss, conductive hearing loss. Second was the diagnosis, fluid behind tympanic membrane, poor school performance, again, mouth breathing history, diagnosis OME, also called as glue ear. Second question. Third, as somebody just confirmed right now, in glue ear, what type of tympanogram? Type 3. Guys, please see, if glue ear plus tympanogram can give 4 questions, mucor micosis 1 question, nerve related question 2, thyroid surgery, piriform sinus question, fine. Then, uncinate process and the total maxillectomy, little twisted question. If out of this we score 1, I think we are going the right path. And press by accusis. I think that was very straightforward question. High frequency loss, 1 question. Look at this, where we are right now. No, nothing to really prove that. Okay, I'm saying that if you know the subject, you can crack a lot of questions. Shortcuts won't work. Now, please see, this was there, again, as a very, easy mark to score. Narrowest part of larynx in adults. I think we know glottis. Let me show you a snippet of your notes. This is I taken a snippet from your notes only. Difference between pediatric and adult larynx. And I think we written there 2 star. Why? 2 questions can come. Position, C3, C6 adult, C2, C3 had high. And we have written over here, there, look at your notes also, high larynx in infant prevents aspiration of milk during breastfeeding. And narrowest part of children is subglottis, but the adult is glottis. One time they asked in the previous paper was, narrowest part of pediatric larynx subglottis, adult is glottis. Could you attempt this question correctly? Do you remember this snippet of your notes? Revise the notes 2-3 times. Revise the main same note to be revised 3 times. Did you attempt this question correctly? Tell me. So glottis, also called, like glottis, supraglottic probably lead to the inspiratory stridor. That was one question. Narrowest part of pediatric larynx is subglottis. Adult larynx is glottis. Correct. So please confirm this question. They have written correctly. Now, again, mastocytis ear infection can lead to abscess formation. Okay. Now, again, I agree. I told you in the class also, some question come based on notes. They will check your presence of mind also. TC. Let me show you another snippet from the main DT notes also. Abscess formation mastocytis. This is a picture we have done. Most common site is the post-auricular, behind the pinna. Okay. This is the most common site. This is the bezold abscess. Okay, Sitley's is along the digastric. Okay, digastric. I think we know this bezold abscess along the neck, bezold sternocleidomastoid. Sitley's is along the digastric. Please see over there. Now, I think he says that he put an arrow like this also over there, that there is an abscess over in this area. I think even if you don't know, you at least know it can't be bezold, it cannot be Sitley's. Why? They are neck abscesses. Their neck, because we know in the class video, along sternocleidomastoid, along digastric is bezold and Sitley's abscess. These two are neck muscles. Okay, fine. And it just see the anatomy better. Don't you think? Remember zygomatic fracture. Okay, remember your class notes over there. Zygoma is this bone over there. It's also called the tripod fracture. In zygomatic fracture, second common fracture we discussed in the class. This is the zygomatic area. And if you know the zygomatic bone also, you know the answer is zygomatic abscess. And this question is actually part of the knowledge actually. It's not like you can say, no, bahut mushkil aa gaya, bahut tough aa gaya. Certain question, they're going to check your understanding. Not, ye koi 11th ka exam nahi hai, physics ka. They will give you a situation, they will ask you an abscess. If that occur in this area, what is the name of abscess? The answer is zygomatic abscess. Now, please see, everybody, please tell me, tell me, did you attempt this question correctly? Everybody, like bezold, and please look at your note. Bezold will be neck abscess. They never marked arrow in the neck. Always see the common sense over there. Zygomatic. Did you attempt this question correctly? Because this is something is actually very, very, part of the, your conceptual knowledge only. Because ear infection go this way, that way, but they gave an abscess over there. The answer of this question will be the zygomatic abscess. Zygomatic abscess. Okay. Now, 2 questions, please confirm. I was asking just now only in the Telegram and the WhatsApp channel also. Stability reflex. One question was stability reflex, and I think we know that stability reflex. S for stapedius, S for 7th nerve. The facial nerve is the efferent nerve, and the facial nerve is responsible for stability reflex. And stapes works like a piston, and the loud sound will make the stapedius muscle contract to make the piston a little tight to save the inner ear. So if you remember facial nerve notes over there, you have got the facial nerve notes. Just look at that. Look at the anatomy of the facial nerve over there. And in the anatomy, you've written that there are 3 branches of the facial nerve. This is the first genu give the first branch. The second genu gives second branch. Just look at your main notes over there. This is the second genu area. And this one is the nerve to stapedius. S for stapedius, S for 7th nerve. And in Bell's palsy, this reflex is lost. Bell's palsy is the low motor neuron palsy of the facial nerve. In Bell's palsy, the stability reflex is lost. Therefore, in Bell's palsy topic, we written that patient has got hyperacusis due to loss of stapedial reflex. So which nerve was asked in the which nerve responsible for the auditory reflex? Is the answer is facial nerve, and Bell's palsy. This reflex is gone, therefore hyperacusis over there. Okay. The second was HPV, human papillomavirus. Is linked with which cancer? Is virology question and general question. HPV, cancer cervix is there, but out of head and neck cancer, if you remember, Epstein-Barr virus is for nasopharyngeal carcinoma. In ENT, HPV comes in our notes as the laryngeal papilloma or juvenile papilloma, HPV 611. But HPV is a very important etiological factor in the oral cavity cancer also. Oral cavity cancer also. Oral cavity cancers are mostly due to smoking, tobacco chewing and all that. But one viral culprit is oral cavity cancer or oropharyngeal cancer. Oropharyngeal cancer. So if I hope you remember this question, virology plus surgery, ENT overlap question. Which cancer is most likely linked with the HPV? Will be oral cavity or oropharyngeal cancer is the correct answer. Laryngeal carcinoma has got no viral association like that. EBV is for the the nasopharyngeal carcinoma, and I think laryngeal carcinoma is mostly due to smoking and all that. And that the correct answer will be oral cavity or nasopharyngeal carcinoma is definitely like the Epstein-Barr virus. No, oropharyngeal oral cavity is same thing. Okay, oropharyngeal oral cavity cancer same thing. But by chance both are there, then of course the oral cavity cancer. Oral cavity cancer. Lung abscess, yes. Lung abscess is inside the external auditory canal. Please see, if infection is in the mastocytus, if it goes here, Bizold abscess. If it goes here, Sitley's abscess. If it goes here, zygomatic abscess. But if it make an abscess inside the external canal, then it is called lux abscess. L-U-C. L-U-C. Lux abscess. Okay, fine. So lux abscess is inside the external canal. If by chance both are in the option in this question HPV, then oral cavity cancer is a better answer than oropharyngeal cancer. Now, as I told you that trauma and the airway is asked. Maxillofacial trauma. If you remember tracheostomy questions, tracheostomy said that maxillofacial trauma, we cannot intubate the patient. We have to go for tracheostomy. But if you remember this thing, just look at the pages, membrane of larynx page. This cricothyroid membrane site of surgery called cricothyrotomy. Here you have written three things for airway. First is intubation, not possible tracheostomy, not possible cricothyrotomy. This is cricothyrotomy. So in this patient, he says that the intubation is not possible. What is the immediate next to it? If intubation is not possible, bronchoscopy is not possible. Laryngeal mask airway won't be helpful in this patient. If you can't intubate, how can the air go from the laryngeal level only? So it means that you have to go below the vocal cord. Of course, nasopharyngeal airway is a total, this is a combination of anesthesia ENT question. Only thing possible is cricothyrotomy, because in our notes, we have clearly said in the main video lecture notes that intubation number 1, tracheostomy number 2, and 3 cricothyrotomy. If cricothyrotomy was not there, they can say cricothyrotomy also. Cricothyrotomy is same as cricothyrotomy. If tracheostomy was not there, then cricothyrotomy is the answer. Because all these three would not be helpful if intubation is not helpful. Think this is anesthesia overlap question, I agree. But just see this word and this, membrane of larynx, topic. Just look at your notes, and I want you to be really very, very clear that what is written where and how they're asking this question. Okay, fine. So number 1 is intubation, not tracheostomy. But in this question, tracheostomy is not there. So the answer is cricothyrotomy. If tracheostomy was there in the answer, then tracheostomy is definitely the better answer than cricothyrotomy. Because a lot of people, can you confirm everybody, tracheostomy was there or not there in this? Tracheostomy was there or not there? If tracheostomy was there, then that's the correct answer. If not there, then cricothyrotomy is the next best answer. Again, this question about tracheostomy. Okay, fine. Tracheostomy. Yes, tracheostomy was there, then of course tracheostomy was answered. But because if not there, then of course cricothyrotomy. One more question of tracheostomy I got from the students was, they put an arrow like this and they asked, what is the relevance of this? And I think we know it is the cuff of the tracheostomy tube. And I think, let me show you the snippet of your main notes only. The two type of tube. This is the Portex PVC cuff tracheostomy tube. Look at your notes and you know see cuff decreases aspiration. Cuff decreases aspiration. Okay, cuff decreases aspiration. Fine. So again, there's a disclaimer. We don't know which question came, but this is the why I wait for 2-3 days before I do the recall. I try to ask a lot of people what was there. Some people say that this was a choice, this is not a choice, but a lot of people say, and please mark NEET PG people, tracheostomy is asked in every exam. The airway will be a very important component. Every doctor should be aware about the airway situations, and the decision taking capacity should be good over there. Okay, fine. Yes. I think people are confirming that this was there actually. I think Sunil is also saying the same thing. So this was a straightforward question. His answer is prevention of aspiration. I think we have done the notes also that, you know, cuff decreases aspiration over there. Okay. These are the snippets of your own main notes. That is for sure. What is the message to your juniors? Because only you can tell your juniors. All university, the one person listening, tell your juniors, avoid shortcuts. Avoid shortcuts. Please understand, for ENT, I'm requesting avoid, you know, Telegram, YouTube videos. Because that is creating the biggest problem right now. Because people watch 3-hour, 4-hour content, shortcuts, and then they go over there. They're clueless about, because they twist the question. Examiner twist the question. Avoid Telegram, YouTube videos. Very important. What is the correct recipe? First of all, main video content. This is for your junior. Main video content followed by QRP 5.0 revision video. That is, and attend the grant test, the MIQ questions, you know, HIT session, which we give over there. This is what is the recipe for covering majority question out of the subject. Like that. Okay. Very good. Now, please look at this question. Again, trauma will be asked, and you know, temporal bone fracture, complete topic in our notes. Ear is nothing but temporal bone. Ear is a journey inside temporal bone. And we said that the temporal bone fracture can lead to CS sevatoria, facial nerve palsy. Patient is having history of fall. Bleeding from ear means what? There is a chance of temporal bone fracture. I think ear is nothing but temporal bone. I would not go for X-ray skull. X-ray is not sufficient to comment on fracture of temporal bone. Of course, the CT brain knot, MRI brain knot, it is CT of temporal. Ear is nothing but temporal bone. Guys, do you remember this statement of ear? We said that ear is a journey inside the skull via temporal bone. Do you remember this? Yes or no? Ear is a journey inside the skull via temporal bone. Okay, fine. This is what actually, you know, they are asking. How many of you attempted this question correctly? I want everyone to comment that did you attempt this question correctly? Because fall, ear bleeding is indirect. A doctor must be able to process information actually. It is not botany, zoology like that. And I'm sure a lot of you would have think right about it, and you would have marked this question CT temporal. And you know, this is what they want to judge. They are, see, you are the intern over there attending this patient in the emergency. You won't manage this patient, I know that. But you should know why your consultant is asking to get a CT scan of temporal bone. Okay, now, this one we're done. And these are the various questions which actually I could recall. Please help me if I miss any question. If I miss any question, and please understand, you know, look at the arenas where they deep dive into it. There's presbycusis is there, you know, like, let me add, you know, to you this thing. The presbycusis is there. One question over there. Presbycusis is there. Okay. Then stapedial reflex is there. Stridor is there. Which part of adult larynx is narrow? You know, that is there. The tracheostomy versus cricothyrotomy is there. Cuff of the tracheostomy tube has been asked over there. Okay, guys, please correct me. You know, like this, anything which you think that, oh, two question I understand. Uncinate process, attachment middle turbinate, and the second is a picture of maxillectomy. The two bounds are always there in NEET PG, INI, CT. But if the 16, 17 question asked over there, if you're able to attempt, you know, 13, 14 out of them correctly, I think that is the mastery on the subject. Anything I'm missing, please let me know. And please, I would want you guys, after the result is declared, to make small videos and about ENT I request, because I get a lot of good emails and the Instagram messages by your juniors who are third year, fourth year in the universities. They say, Dr. Dhawan, we saw your Telegram or YouTube videos and we are very happy about that. But my worry is that content is 4.5 year old content actually. Okay, so thank you very much. And at the end, I would just say this thing that we wish you all good luck. Do not worry, do not panic in this situation, as the result is awaited in a couple of days. And please talk to your parents, because to your friends also, spend some quality time, and approach your parents with confidence that I've worked really hard for my examination. So whatever result is, we'll face it together. If it is a good result, hopefully it's a good result, we'll be celebrating together. But do not worry about unnecessary staying awake, thinking about what can go wrong. Rather than look at these questions and count your blessings over there. I say, count your blessing out of mucor micosis. This is a blessing. Presbyculosis is a blessing. Blue ear is a triple blessing over there. Nerve injury is a double blessing over there. Tympanogram, 2 questions. Like stridor, 1 question. Airway, trauma to ear. That's what, at least let's have a hope to, do well in the examination day. Okay. Thank you very much. Okay, fine. Always, they just look at the new content. I'm telling you, Tbilisi, Georgia, I don't know which month, because I went 2 years. Always look at the latest content. Cottle's test, okay. Cottle's test, I'm not sure about that question. Anybody? Cottle's test is for the nasal valve obstruction. I think that is there on the first page of the nose notes also. The Cottle's test is about lifting the cheek and it gets relief of the nasal valve. Thank you, Shan, and I wish you good luck. I'll be waiting for your messages. I always wait for one message, Rajiv, we passed the examination, and this is what. Thank you very much. Thank you. Yeah, Tejas, that would be okay. Yeah. Okay, guys, bye. I'll take your leave now. Thank you very much to the team for organizing the session. Thank you. Thanks a lot. Cottle's test, again, Cottle's test is there. Again, it's a blessing. Cottle's test is actually then, I told you there that this is a visual question, lifting cheek with the 2 finger up. This is what the nasal valve area. Blowout, I will not count on my side. Blowout is always belonging to ophthalmology people. I purposely did not include blowout fracture. Let it the ophthalmology people. Otherwise, they will call me, Dr. Dhawan, you're teaching blowout fracture also. Blowout is an age-old question. Cricket ball injury leading to anophthalmos, the teardrop sign. I think that's a show, but I will not keep it. Just to increase the ENT question, I would not put the blowout fracture also over here. Wow, first page of notes. Everybody please see. Everybody please see. Cottle's test. Everybody, do you remember Cottle's test question came? Because this is news for me. Cottle's test came. If Cottle's test also came, they want you to pass the examination. Please confirm. Okay. No, Cottle's test is for the nasal valve obstruction at this level. Cottle test is for the nasal valve obstruction. No worries, I'll check and I'll post on this thing. I will request everyone, the NEET PG people also, to look at these questions seriously, to look at these notes so seriously. These components of the PYQs are important. Chalo. May I take your leave? Please stay relaxed. Please watch some movies. Do not create undue panic. अच्छा काम किया, बढ़िया काम किया, अच्छी पढ़ाई करिए. 100% किसी को नहीं आता होता. Do not worry about it. I keep saying that. Just have this thing that will get adequate marks to pass the exam comfortably. I would like to ask you a question, because now it's a retrospective analysis of what we keep talking before the exam. Did this thing strike you in the exam that everybody will have certain question unknown completely? 50, 60, 70 questions are unknown completely, no problem. Or partially known question are there. 80, 90 questions are straightforward question. 100, 120 questions are twisted questions. 80, 90 questions are straightforward question. 100, 120, 130 questions are same topic asked in a twisted manner. The topics were similar, but choices were very close. Topics were similar, but style was asked different actually over there. Okay, fine. So that's what this thing. And second thing is that, in the clinical question, always, must have felt that if they give you main theme of question like old diabetic patient with black thing, mucor micosis, do not worry about the other things because we are there to crack clinical vignettes over there. Chalo. Okay, thank you very much, guys. Please have relaxed time. We pray for your success. like every member of the team will be very, very happy to hear that you passed the exam. At DT, everyone is so much excited to hear this news that you passed the exam, and please stay relaxed, stay hopeful, stay calm, and do not expect any bad outcome. Just keep praying that may I pass, may my friends also pass exam. Okay, guys, thank you very much. Take care.